We have been asked to make a short video on how to assess whether a patient is physically ready to come off the recovery cart and either pivot transfer to a chair or if they're appropriate to walk into the room on post-op day 0. So the patients had surgery earlier today, and we want to just make sure that we're doing a quick test to make sure that we're keeping the patient safe and ourselves safe while we're trying to move the patient from the cart into the room. So we're going to assume that Courtney had a spine surgery, so the first thing we want to do is, number one, make sure the cart is at an appropriate height. If it's way up high, go ahead, lower that down first. Okay, we're going to want to make sure we do the log roll technique to get her sitting at the edge of the bed. So go ahead and bend this knee up, reach across, roll onto her side, feet over, and then I can give her a little boost here. Okay, number one thing is to make sure that she's going to tolerate being upright. So go ahead and have her sit for a minute, make sure she's not going to get dizzy or nauseous, things like that. This is a good time to get the gait belt on her. You should use the gait belt on everyone. You want to make sure that you're paying attention to where their incision is, and if you can, keep it off their incision. And the lower you can put this gait belt, the better off you're going to be. So Courtney is doing pretty good. She's okay sitting at the edge of the bed. So now we're going to move into the egress test. There are 3 parts to the egress test. She needs to pass all 3 of those parts to be deemed okay to actually walk into the room. So we'll go through that now. The first part is, go ahead, Courtney, scoot forward a little bit so her feet are touching the floor. The first part is we just want to see if she can clear her behind from the cart by just a couple inches. So go ahead and try to push up. I'm going to have my hands on that belt just in case she needs a little help. Okay, bring your feet a little farther underneath you. Okay, so she did well with that. The next step is to have her to come to a full stand 2 times. Okay, ready? Up, good. And then back down. Good. One more time. Good. All right, so she's doing well with that. If she did not do well with that, what I would do is have her sit back down on the cart, lay back down, and the appropriate thing to do at that time would be to do a lateral supine transfer from the cart over to the bed. Okay, but Courtney did well. So just for safety's sake, we're gonna go ahead and put a walker in front of her for this next step. Okay, so she's got some upper extremity support. The next thing I want her to do is to march in place, 2 steps with each foot. So go ahead and try to just shift your weight, make sure she can weight bear through either leg. Good, okay. If she did not do well with that, but she's able to get to standing, then the right thing to do would to bring the chair right up close and just do a pivot transfer with 2 people over to the chair. We're gonna say Courtney did well with that part, so the next part is for her to try to advance her feet back and forward and back 2 times each. So go ahead and kind of out front and back. Good. Okay. Did well with that. Again, if she did not do well with that, then I would stick with the pivot transfer over to the chair. But since she did well with that, you can assume that it's pretty safe to have her go ahead and walk a short distance into the room over to the chair. You may still want to have 2 people, especially if this is their first time being upright.